am here with Elena Warkentin, who is a chiropractor in Fort St. John, BC, and she's also a disc golfer. She just recently competed at the Las Vegas Challenge, just the LVC. Yeah, yes. Cool. And her and I connected a couple years ago through disc golf, and more recently we've been talking a lot about foot health, particularly as it relates to rehab, prevention, strengthening, treatment. Mm-hmm. We're both huge fans of barefoot shoes. I think I have 15 pairs. I think she has about 15 pairs as well.
At least. As a chiropractor, we look mostly at joint movement, and there's 33 joints in each foot. And most people don't realize that you can adjust those joints. And when we do an adjustment, we're not just making a pop, we're getting more movement out of a joint that isn't moving properly, which happens once it's under stress. Like you roll an ankle and your heel can not have the same motion plane that it's used to having, and that really impedes movement then.
Yeah, and I know a big thing too is, with a sport like hockey or football, collision sports, our bodies are not really meant to take that impact. A sport like disc golf or Frisbee, ultimate, joints are under a lot of stress, whether it's knees or shoulders, but especially in disc golf, the twisting and the turning on our knees and our feet and our ankles is not normal. And so we know that injuries will happen. We know that stresses will happen. So part of it is how to prevent that from happening. So how big of a role does footwear play in that, do you think?
I think it's huge. Okay. It's a sport that you're walking the entire time, and then on top of that doing an explosive twist, like you're saying. And so there's a lot of torsion and a lot of stuff that goes into the foot and like from the feet up. And really that's your base, is your feet. And you hear a lot of disc golfers complain about their knees or their backs eventually being issues, and those are things that can be related to what they're wearing on their feet. Yeah, and
not to call them out, but I recently had the Adidas Terex. I got a deal through Innova. Fantastic structural shoe.
Yeah,
but
like the durability,
the sole
and
is super
stuff,
thick. I've had a couple pairs now, and a huge challenge when you have such a thick sole is when you twist, you're rolling right over. You're not on the ground, so it's easy to roll your ankle.
For a couple of reasons. One being the height, but the second reason where that height is more drastic is because you're not just at an elevated shoe, you're also elevated and tilted, because they build up, in traditional shoes, they build up the heel more so than the toe. And that actually puts you part of the way into a rolled ankle anyway, because you're sitting farther back on the talus bone, which is narrower, and anyway, with the biomechanics, you're already kind of going that direction. So you're not in a very stable position to twist. Yeah, and that happens a lot. Calvin Heimberg is the most famous example of what can happen when you you turn on your shoe. Something you noticed on a video a couple weeks ago was Eagle. He was wearing... I noticed that he was wearing Vivo barefoot shoes, which I really appreciated. It was great to see that.
And I think it's the same. I have the same pair, I think.
Yeah, I think so.
They're pretty awesome. They have the little grippers on the bottom. And Vegas had the turf tee pads. But sometimes we'll play on concrete tee pads. It doesn't matter how good the shoe is. You scrape on concrete, you twist on concrete, it's going to wear them out. Yeah, you're still going to have wear issues no matter what shoe you're wearing. It's going to last. I think Eagle talks about it lasting like just a couple months or something like that. And it's just an investment. It's not like, hey, let's buy a cheap shoe because it doesn't last that long, but it's let's buy a really good shoe knowing it won't last that long, but that's part of being a professional disc golfer or a professional athlete. One of the challenges with ultimate Frisbee, being Frisbee Rob, I like talking about all disc sports, but with Frisbee, they don't really have a good cleat. That's so, they're really stiff, which you kind of need when you're planting and stopping. Same with football, right?
You need something that's going to grip. And when you need to suddenly take off and go straight into a sprint.
That's why Vibram 5 fingers are not
they're not ideal.
That's why people shouldn't go barefoot either. And you might get stomped on.
Like you need a shoe that's a bit more protective, because if you get stepped on and then you're opening yourself up for injury. So there's relativity in what you put on your feet, but there's certain characteristics that I try to steer patients towards looking to. I basically break it down into 3 characteristics. One is, like we talked about, the heel to toe height ratio, where if there's cushioning or even just how the shoe is built, you want it to be what's called zero drop. So, and that puts your foot at neutral, and there's lots of mechanical benefits there because that's how you're built to run and move, is from that plane.
So it's not so much that the shoe has to be flat on the ground, it just has to be zero from heel to toe.
Heel to toe, the same height.
Okay.
And there are shoes out there that they still have cushioning through it, and sometimes that's a good transition shoe for a patient, or for a patient that I know is not going to be able to do lots of activity, like my elderly patients. I don't put them straight into a barefoot shoe if they can't walk on hardwood floors anymore.
Yeah, that's true.
Building up strength is not going to be as easy for them as somebody younger.
One thing is zero drop.
Zero drop is the one thing, and zero drop works up the chain. So there's a couple things with going zero drop versus being in an elevated heel. One thing is, and even shown in, there was a study that showed the relationship between an elevated heel and increased osteoarthritis in the knee buildup. And that was a really interesting study. The idea behind it being that because you're elevating the heel, you're now transitioning your center of gravity forward. And so that puts more stress on the knee. And then that also puts stress on your low back. And as a chiropractor, we look at that a lot. But if you think about it, if you're leaning forward a bit because of the shoe, like even that little bit, you're going to have to adjust and even potentially hyperextend a little bit in low back
to
knees, make up for
hips,
that.
Back, neck, all the way up the
chain. It goes up the chain. It's less so the higher you go up, unless it's really bad. But I mean, so yeah,
like
but the most common area, the most common areas are low back, knees, hips that I see in relation to that. Hips, especially with I see a lot with runners, knees and hips, because not just because of like the wear and tear aspect, but it actually changes your running style. That when you have that elevated heel, your heel is contacting the ground sooner, and so what happens is you can't use the Achilles and the calf muscles as a spring, which they're intended to be used as. So your body goes to the next spring and you get quad dominant in your running, which is a huge issue for a lot of runners and people who work out.
And that's why, so the first time that I ran in Vibrams with barefoot shoes, my calves were super sore.
That's
because I was so used to quad, and now I'm going to a different
You're using them more than normal. And then also you were down to zero drop. So now the stance position in the gait cycle was more of a stretch for you at the same time as working it out. So you're doing an eccentric workout for those muscles, so you're going to feel it right away.
And I wasn't used to it.
Right, which is why I never
run with a different shoe to ease into that.
Which is why I never tell a patient to just put these shoes on. You have to hammer in that you're going to do a lot less distance or activity in the shoes at first, because otherwise that's how Vibram got into trouble with stress fractures, torn Achilles, things like that when they first came out, the 5 fingers, because people who were running 10K plus or whatever tried to go put these on and go to what they're usually doing. So which
don't do that.
If you is going from having something that is doing the job for you, or making it so you don't stress that area as much, to suddenly putting a ton of stress on it. The second is flexibility in the shoe. So the reason for that is so that the shoe moves with your foot. You don't want it to impede movements, because as you go through the gait cycle, for example, in the stance phase, early stance phase, you're going to go into pronation. That's part of the cushioning mechanism. And pronation has gotten a bad rap for calling people with flat feet or you're over pronator. But the idea, it's okay to pronate if you can supinate as well. If you can go back and forth, you have a strong foot. That doesn't, if you can't do it, it doesn't mean that you need an orthotic. No. It means you need to strengthen. And a shoe, having a barefoot shoe is not necessarily going to just strengthen it for you. That's why I work with patients to do specific exercises and use certain tools to strengthen the foot, because they have to learn how to walk again. They have to learn how to arch up again. And so you go through that pronation and then into late stance phase through the cycle. Then you go into supination and get more rigid before you push off. Right. And so you need a shoe that allows that to happen. So we've gotten so hung up on having motion control. Yeah. And like there'll be companies like the Running Room, stuff like that, where some kid puts you on a treadmill and tells you, oh, this is the type of shoe you need. Yeah.
And it's all scientific, and they say the right things, and they have all the different types of shoes that fit in different categories.
There's a formula for it that they follow, and so really it's in that aspect, in the movement aspect, it's what I'm trying to change in people's mindset is to think of the foot as a moving part of the body, just like everywhere else that we train, rehab, treat. That why is it that for the feet it suddenly is just, oh, you just need orthotics, or just go to something static?
Flexibility, right? So the second part is flexibility, but you can have a flexible shoe, but if your foot is not flexible or strong, then that doesn't work. And if you have a flexible foot and a really stiff shoe, that doesn't work. So you want to have a strong foot and the proper shoe. Yeah,
and then you're even talking about like having a flexible enough foot, and that's where being a chiropractor, I think I have a bit of an advantage doing the joint manipulations to allow the foot to get into positions and postures that it's supposed to do. Yeah. It's amazing the difference. You see it the most when you have somebody who had an ankle injury like 14 years ago. Maybe they broke their ankle, maybe it was a bad sprain, but then you bring the foot up into dorsiflexion, we bring the foot up, and they're only going to neutral, like just 90 degrees. You're supposed to have more movement than that. And then I do the adjustments, and it's immediate change, and it's awesome to see. And then the patient can really see this is the value of having movement in the foot, because they are moving again. So and that you're able to keep that up when you keep on moving the joint.
Well, and related to speed skating, for example, the more flexible your ankle, the faster you're going to be. Right, that's a big part of being, training for speed skating. And that's always really interesting, but it makes sense because the longer that the blade is on the ice, the more glide you have, the more power you have, and if you can flex that ankle even further. Yeah. So
and if you can get the push behind you more, because you can have more ankle flexion. But it's still confining, but yeah.
And that was one of the things we talked about was Usain Bolt, LeBron James, amazing athletes, but their feet, if you just Google their feet, but two amazing athletes, and Usain Bolt, fastest person ever, to adjust to try and get his foot, so it's not all scrunched together, would make him slower. And so sometimes you sacrifice performance when you do that, but at the same time, could he fix his feet? Maybe if he focuses for the rest of his life.
It would be something that would have to be post-career, because it's not something that, at this point, he has trained his feet into being the equipment that they are. Totally. And that's how he knows how to run. And so, and you don't mess with that with an athlete like that. And that's sport specific. That's you can do that with a disc golfer or somebody who's playing a sport that isn't about time. It's about technique. And
well, and in disc golf, we will always see issues with shoulders and elbows, people throwing forehands. We cannot make that throw safer. That's just how it is. It's just not a good throw for our body.
The only way to make it safer, I think what you're going to say is minimize the risk of injury by being in the best shape as possible.
Or learn to throw backhands left and right.
Mix it up,
you can balance both sides of your body.
Which is good for your game anyway.
It is. So second thing is flexibility.
So, and then the third thing being the shape of the toe box. That, and more with the years that I've put into working on feet, I've seen how important that is. I used to think that it was more the other two, but it's amazing how the difference when your toes are able to stay straight versus when they're condensed. And you can find pictures, you might want to put this on your video too, of a shoe that has started to shape a foot versus a foot that is just straight and as is. I mean, if you look at a baby's foot and like how we're born, we're not all condensed up, and that's not something that happens through genetics. It's something that, like, look at our footwear and you'll see how it happens.
And our foot, like, our feet are supposed to be wider at the toes, but the shoe is narrow at the toes, sometimes in the heel, and it's like, well, that's not how our foot looks.
And a great example.
And it's a fashion thing.
And it totally is. And a great example of the importance of having the toes being straight is how the arch on the inside of the foot, the medial arch, works. That it doesn't stop at the ball of your foot, which is the way it's treated. It stops at the tip of the big toe. And there's a muscle on the inside of the foot called the abductor hallucis muscle. And it's a small muscle, but it's the one that brings the toe in. And so that's one of the muscles that you need to create that arch. But there's so many shoes that are curved in the toes, and so it's limiting that. I'm more concerned about function because that'll limit pain the most. And also, I'm concerned with function because I don't want it to progress. And the thing with bunions is the really bad ones, most of the time they're not going to reduce because the joint changes have already happened. The bony changes are already there. It becomes a lifestyle change because whatever time you're going to put in a shoe that isn't maintaining that demand, maintaining the strength, because it was the strengthening that really brought your foot back.
Completely. It was a strength. It was, even going back to the shoes again, it did help. I remember there was a few times on the treadmill in the beginning, was wearing the barefoot shoes, and it was super painful. But it was a little less each time. And that was helping with the strengthening because I wasn't just wearing the shoes, I was doing stuff in them.
And a lot of that comes from, like, because, when you lose the strength in the foot, then you start to put a lot more pressure onto that plantar fascia, and it's not intended for a primary stabilizer. That's supposed to be your muscles. So
it's overworking it too. And so I think that's super important, and there's a lot to get into with this for sure. I mean, we've just scratched the surface. If people don't have the time or the ability to come talk to you or see you for treatment, or maybe go to a chiropractor who, I don't know if a lot of chiropractors specialize in foot.
Unfortunately, not a lot keep it up. I mean, we're mainly backs is what we're known for, and that's all. And I don't fault the profession for that. I mean, it's what we started with and do well, and so, but we are taught in school how to adjust the foot, and it's what I've seen in practice being such a value to patients. And even with those patients that have reoccurring low back pain, I've found that when they bring up, and I have this foot issue, I'm like, I can treat that. We can look at that. And then when we get some resolution there, suddenly I'm not seeing them over and over again for the same low back issue. And it makes a huge difference.
And it is life-changing. And the thing is, too, it's just a daily thing. Like, if you follow Healthy Feet Daily with Brad, he's unbelievable, just the little tips that he has. And I see people all the time saying, I have this, how do I fix it? Or I can't even walk barefoot in my house, it's so painful. And it's really cool to just jump in and see some of the conversations and the comments. And there's so many people having this issue, but in Born to Run, the Nike rep talks about going to, I think it was the University of Oregon, and all the runners had taken their shoes off. And they were like, well, your shoes hurt our feet. And they're like, oh, interesting. Okay, maybe this is not the right thing.
Should be a sign.
Like, we're not doing something here
That was
properly,
us in volleyball. It was like, we couldn't wait to get our shoes off after, like, that's how I was and a lot of my teammates. And I played volleyball through university, and it never changed. It was always like whatever shoe I was in, and I was told I was wearing the right shoes for the sport, that when play was done, I could not wait to get them off my feet. It's definitely a sign.
And those there. 3 tips help. And so specifically with disc golfers, if we just want to say to disc golfers, here's a couple things that you can do right away.
Yeah.
So it's find a shoe that has a 0 drop. So if it is thick, at least just find out if it is 0 drop.
I would, try to go with those. We mentioned a bunch of brands that work well.
So Vivo, Lems, 0.
Yep.
Magical shoes.
Yep. Usually the ones that I recommend the most are probably the 0 and Vivo Barefoot. And
we'll put links below.
Yeah.
I think you have a link that will take people where they can buy them. Because there's multiple
for 0
pages
shoes,
and links.
I've got a link for that. And then also, I would try to find a chiropractor that works on feet. Yeah. And it's unfortunately the things that you have to look for is going to be what kind of things do they sell outside of the treatment? Yeah. If they do orthotics, they're not going to be this kind of mindset.
Right. Correct toes. If they sell correct toes, then...
If they sell correct toes, that's a very good indicator, because correct toes, that's the tool that I use the most with patients. And that's a really good training tool. Yeah. It doesn't cost a lot for what it does. It's a silicone toe spacer that is built to run in. It was designed, marketed by Ray McClanahan, who is the podiatrist that got me into doing this. I listened to him speak in Portland, where he practices, Portland, Oregon. And it just made sense, and it got me down this road and healed a bunch of things for myself. But those correct toes, even after having done barefoot running and training and making my knees feel like they've never felt before, and even running a half marathon in Vibram 5 Fingers, trying the correct toes, and it's like it was still a workout for me.
Interesting.
And it was still a challenge.
Because you're not used to your toes staying separate.
And not engaging the toes.
Yeah.
And like we talked about how that is a part of the foot that needs to engage. And you have, there's another arch that spans the toes that people start to lose when they just don't have that strength there.
It starts somewhere, so she gave you 3 really good tips to get started. I'll have links below to the different shoes you can buy, the correct toes, and we'll put some other links to maybe some resources as well.
Yeah.
We'll find some good YouTube videos that people can get started with.
Yeah.
But I think this is a good starting point, hopefully launch you into your own exploration and discovery.
Yeah, and you can even, I'll give you some contact info too. Perfect. I'm happy to talk about the subject. It's something I've spent a lot of years working on, so almost 10 years. So
it's amazing.
It's a real passion of mine.
That's amazing. Awesome. Well, thanks
so
for having me.
I'm always happy to talk about it.
Thanks for having me here.
Yeah, thank you.
Awesome.